Well, hi, I'm really happy to see all of you. And how about, what would you like me to start with? We went through a couple of your, thoughts about being what I want to be in healthcare. And like I said, it's pretty hard to get to every one of you, but if somebody would like to at least talk a little bit about what they want to do and you want to share that with the rest of your mates, that would be delightful. Otherwise, we can just get into some topics. And if you have a specific topic that you'd like me to address, I'd be more than happy to do that. Or I can just go ahead and start talking. So what would you prefer? Don't be shy, just say so.
Let's talk a little bit more about nursing, if you don't mind today, Pat. And I think if you wanted to cover maybe, I think some of the questions that some of the students might have is like, for example, what would be the difference between licensed practical nurse, registered nurse, and that nurse practitioner position? Because you kind of talked about some careers that could be within all three of those different types of nursing.
Sure, absolutely. Well, let's get started. And if you have any questions, don't hesitate to, I'm fine with just saying, Pat, I have a question. I'm not really formal. I'm not formal in my classroom, and I don't want to be formal on Zoom either. So feel free to do that, to just say, please. So I was thinking about this last night when I started teaching. I was in the practical nursing program, and I absolutely loved practical nursing. I love practical nurses. That's where I learned a lot of my ins and outs, the nitty gritty, if you will, of healthcare. These are the bedside nurses. These are the nurses who go into labor and delivery, and they're the ones that scrub and hand sterile instruments. The RNs don't do that. I mean, they could, but the majority of them do not. The majority of the RNs give IV injections to the mamas and deal with the babies. So LPNs definitely do have a place. LPN can also be known as an LVN, which is a licensed vocational nurse, and a licensed practical nurse are one and the same, just different states, different words, if you will. So a practical nurse maybe will go to school, depending on, and remember, everything that I say for time of or school length, it really depends on whether you go full-time or part-time. So I think you would understand that or would realize that. But a practical nurse probably goes to school anywhere between 18 months to 2 years. Now, you might even see some a little bit less than 18 months, but generally speaking, when I was in the PN program, it took our students about 18 months. That was full time. Why would you be a PN, an LPN, instead of an RN? Well, it's a little bit shorter. The responsibilities are not as great. You have a lot more bedside nursing. And if that's your goal, to be in there with your patients, that would definitely be something to look at. There are viable PN programs or LPN programs yet today. Some people are thinking, well, the LPN is being phased out. Not so. There's still quite a few programs, actually. And I did list some. I did find a few that I actually didn't even know existed here in Minnesota. But currently, in addition to working with Health Force Minnesota, which is one of the reasons why I'm here, I also work with Hennepin Technical College, and they have an active, viable PN program, practical nurse program, where I used to work full-time, Minneapolis Community and Technical College. They no longer have a PN program. But just to give you an idea, if you wanted to become a practical nurse, you could go, the easiest way to find out where is to Google it. I know that sounds like, oh really, but I was shocked at the number of programs. Rasmussen has a program. So a lot of, even St. Kate's. Now I didn't know that. That was the one I went, wow, I didn't realize that. Practical nurses, when they are finished with their training, their schooling, they start at about $23 an hour, if that's something you'd like to think about. I don't believe that that should be your first reason for picking a career in healthcare. I think you need to feel the dedication in your heart and the compassion for what you do. But it's nice to know how much you will get compensated for when you become a practical nurse. As I said, practical nurses work in nursing homes, they work in hospitals, they work in labor and delivery. Not so much labor, although they are on standby for the delivery process, and they also work in clinics. What's the difference between skills? One of the differences that we see is that the positions are a little bit different in leadership. So when you're a practical nurse, you will work with an RN who will be the leader. Again, I'm talking about in a general kind of hospital setting. If you're in a nursing home, you're probably going to be the only licensed person on the floor. Does that mean you don't have an RN supervisor? Sure you do, but that person may not be on the floor with you. And so practical nurses tend not to do things like IVs. Now, does that mean they can't or they can't learn? Is there any law? Not really. It's more the fact that they're not trained to do intravenous work. Could they be if they're trained? Yes. So I've worked with some LPNs, licensed practical nurses, who do have done some IV work. Would they work in a clinic for cancer patients who have a lot of IV chemotherapy? No, not giving that directly. They could still work there, but in a different capacity. So that's a little bit about what you would expect. You could first be a nursing assistant, which I love teaching nursing assistants. And it gives you an idea a little bit more about what healthcare is all about. And then you could look further and come into the PN program. Many practical nurses decide after a couple of years or more, 2-3 years of nursing, I think I'm going to go on and be an RN. And there are a lot of programs in the metro area that will help you facilitate that desire to become an RN from being a PN or a licensed practical nurse. And a lot of schools, again, you can look at, I'll just pick again Rasmussen. I have no preference. I'm just stating some colleges that you may be familiar with, and they would definitely help you. But the major colleges will also have a lot of programs. Facilities that you work at might even assist you in furthering your education, even as a nursing assistant. So let's say you're working at Shady Pines nursing home as a nursing assistant. You say, hey, I want to be an RN or an LPN, and they will help you financially to get to that point. Now, what happens after you get to that point? Do they expect you to work with them? Yes. I mean, that makes sense. Forever? No, but maybe for a year or two, so that they can reap the benefits of their investment with you. And that's really a wonderful way to get support going to your school. So that's just a real general thought about practical nursing. If that is something that interests you, pursue it. If you think that this might just be a step to becoming an RN, pursue that as well. I think the thing that you should really think about is that whatever aspect you want to be, whether it's a nursing assistant, an LPN, an RN, a physician's assistant, a nurse practitioner, if that's what you want, then that's what you should work for. And let that be in your heart. You're the one who can assess yourself the best. If Grandpa wants you to be an RN and you want to be an LPN, then Grandpa should be the RN and you continue on with your LPN work. This has to come from within you and not from the outside. Because to be perfectly honest with you, when you're a nurse, whether you're a nursing assistant or more than a nursing assistant, you deal with poop, pee, and vomit. That's it. I tell every student I have in the beginning of class, if you can deal with poop, pee, and vomit, you're going to be just fine. If you can't deal with any of those three, see ya. That's just life. That's just the way it is. So that's PN. I know there was LPN. There was a question about nurse practitioner. Nurse practitioner is a big deal. It takes quite a while. It can take probably, I was sort of surprised last night when I'm looking at some of my notes that I wrote down, some of the thoughts that I hadn't thought about. It does take a little bit more time to be a nurse practitioner. It could, after you get your 4-year degree, you then might need to get your master's. Most programs require that you get your master's, and you can do that. That's about 2 years, so think about it. That's about a 6-year, about 6 years, and that's if you go full-time. So if you go part-time, it would take even a little bit longer than that. There are good nurse practitioner programs in Minnesota, 4-year programs to start with to be an RN. Dakota County has Rasmussen again. St. Cloud Tech has a program. I know I'm missing a lot. These are just some. Alexandria also has one if you want to leave the metro area. And those are some places where you could be a nurse practitioner. What do you do as a nurse practitioner? Well, you work under a clinic, a physician. You are allowed to write scripts, prescriptions. You have the physician working directly with you on that. You can make rounds in a nursing home instead of a doctor doing that. I work with a lot of nurse practitioners in nursing home facilities when I'm there with my nursing assistant students, and they're wonderful. You can work in hospice. Hospice, as you know or may not know, is for someone who is going to be passing away in the near future within about 6 months or so from some type of disease. Cancer is the most common one. But nurse practitioners are very, they get into the heart of a patient. They have more time to do that. Now, a nurse practitioner might not agree with me saying they have more time, but if you understand, they don't see patients all day long in the same manner as a physician would. So they get to know their people a little bit more. They have a smaller number of people that they care for. And if you're thinking about financially, a nurse practitioner starts at about, give or take, $60 an hour. So that's not a bad starting salary, $60,000. Of course, you've invested a lot of money in college. It comes back to you. So do you have any other questions about nurse practitioners?
So we have a couple of questions that came through in the chat board here.
Yes. Mm-hmm.
And I think, Pat, I'm going to kind of emphasize a couple of pieces that you had mentioned here too. And I think we try to talk about this not only quite a bit with Health Force, but I think just within this Scrubs Online program, I've been trying to mention to the students as well that, you know, CNA programs right now are very much needed across Minnesota. And it was before COVID, and especially now with COVID, we're really seeing a need for nursing assistants.
Yes.
So I love that you had plugged that, but I think the other takeaway that students you could get from this is that you don't necessarily need to start off in one pathway, and that's going to be your pathway your entire career. Even as
Right.
Pat mentioned in her opening, through her history, her work history, that she's gone through so many different departments, so many different settings. You know, she was a nurse at one point, and then she is now working in education. So there's just so many different things and different pathways.
Right.
I'm going to get to some of these questions.
Sure, please. Please.
So I think there's a couple that have come through about your likes and dislikes on your job. So I think overall, what's one job or one position that you've worked in that you really, really liked? And same thing, what's one position or one job that you worked in or a setting that you worked in that you really didn't like?
That's a great question. And I would say that I know this sounds kind of like, oh yeah, right. Every position I've had and this is true, every position I've had in nursing has some fantastic areas. Why? Because I'm doing what I want to do, and that basically is the umbrella of nursing and working with people. I think it's admirable if you say, why do you want to be a nurse? Well, because I want to work with people. That's great. But you need to be able to want to work with people at some of the most difficult times in their life. That's completely different. It's easy to work with somebody when they're happy, healthy, and everything. But when they're miserable, grumpy, dying, all of the above, it's a little bit different. So one of the things that I loved about clinic nursing was that, again, I could correlate disease process with the patient and what that disease did to the patient and their family. We can't leave family out of this. Family is essential in healthcare. I loved that. Obviously, I loved working with the babies in labor and delivery and the new mamas. It was exciting, scary at times, but it was exciting. I absolutely love teaching. I love, love, love teaching. It's never boring. It's always exciting. I meet new students all the time. I'm not working full-time anymore. I'm only working part-time because I was going to fully retire and I couldn't do it. I despised not working. So I'm still working a little bit every week, and I would say that that is what I need to keep me going. And I'm grateful for the opportunity to do that. Some of the things I did not like when I worked as a director of nursing, I think I mentioned the fact that I was doing paperwork. I didn't like that. And nursing is paperwork. So you got to get yourself set into that, even as teaching. Oh my goodness, teaching. I taught a Zoom class this summer for nursing assistants, and the paperwork was unbelievable. So you have to do it. You just sort of say, all right, fine, it's not my favorite thing to do, but hey, it's part of the job, and if I'm going to do this job, I got to do this, otherwise I'm not doing this job. Simple. So I think that's probably when the part about nursing that is the least interesting to me is when I lose the contact with students now, or lose the contact with a patient or resident, and find myself sitting endlessly at a desk in front of reams of paperwork. But generally speaking, it's a satisfying position. Nursing is a satisfying position, whether you are a nursing assistant for the rest of your breathing days, which is fantastic. As was mentioned, we need good nursing assistants, and or whether you decide to go up to be a physician's assistant. All of these are needed, especially in these unprecedented times.
Yeah, definitely. I have another question here from a student. If a student wants to go and be a practitioner, would you recommend them working as a registered nurse first, or should they just go for their practitioner right away? And, you know, maybe this is a differing question for some students too, but what would your opinion be on that?
I think that's also a good question. Here's my suggestion: be a nursing assistant first. Be a nursing assistant. Get in there up to your eyeballs in this whole thing called healthcare. Go into being a nursing assistant. See how that hits you. And it really depends on your ability to stay in school full-time, or whether you are thinking about other areas of your life. Maybe you, I know some of you aren't there yet, but if you should get there at some point, maybe you want to have a family or this type of thing, and you will not be going to school full-time, then I would suggest you become an RN first. There's nothing wrong with going into a nurse practitioner program from the beginning. But again, I would love it if I think you will appreciate what you're doing when you become a nursing assistant and move on through to be a nurse practitioner. In fact, this summer I had a couple of students that were doing that. They're looking at nurse practitioner programs. A couple of them are going out of state. I think one was going to Baylor, so it's really out of state. And but that's what she was going to do. She was going to be a nursing assistant first, get a feel for what the nitty-gritty of healthcare is all about, and then go into a full program. So it's very difficult for one to tell you what to do, whether you want to go to school full-time. If you go to school full-time, it's really hard to do a lot of working because you're so focused on schooling. If you go to school part-time, then you can work a little bit on the side as a nursing assistant, or if you're going to be a 2-year RN, and then look forward to being a nurse practitioner, this will all take you more time, but if time is not an issue for you, this is really an individual decision. I'm always the one who says get as much experience as you can while you are either firmly deciding what you're going to do, or even while you are pursuing that career as a nurse practitioner. Going to school full-time for a nurse practitioner is not easy. Going to school full-time for anything is not easy. So you really need to be committed to that. I've seen a lot of students who are committed early on to going to school full-time for a long program, and then midway through, life smacks them right in the face and things happen. And I've heard many, many times, oh gosh, I wish I had only done this part-time. So those are things that, you know, if anything I could tell you today is that do a really strong, good self-assessment of who you are. I'm not going to plug this, but I will tell you about this. The Health Force Minnesota, one of my very favorite things to teach is the healthcare core curriculum. And I started teaching that way back in 2000, I think 3, 4, something like that, when I had 2 people in a class. Now it's a prerequisite for a lot of courses or a lot of careers. Health Force Minnesota, and we've revised it a couple of times, the healthcare core curriculum. If that is an opportunity for you to take at your high school or in a college, I highly recommend it. Why? Because it is a huge self-assessment piece. Who are you? What are you thinking? Why are you thinking that way? How dedicated are you? Are you just looking at the glory of being in healthcare, or do you really want to get in there and get your hands dirty? Because if that's, you know, if you want it to look like a movie on the theater screen or on a television show, that ain't it. That's just not it. So it's a lot more in depth than that. So.
And I'll give you kind of another spin on that answer too. And I think a lot of students may fit into this sort of scenario as well. But like we were mentioning too, it's not the worst thing in the world to get that experience right away, work as a CNA for a couple careers, or excuse me, a couple years, get a new career as a nurse. Maybe you went back to school part-time and got an LPN with your practical nursing. Or maybe you went on to get your RN, either part-time or full-time, become a registered nurse. Work in those positions for a few years and see how much you really like that, because every step that you go, there's new responsibilities, there's new duties added, a lot more education. And I think even with the financial piece too, school isn't very cheap.
Right.
I was going to school full-time, and this was about 3-4 years ago, my senior year of college, and I had 5 different jobs I was doing while taking anatomy and physiology, and that is not fun.
No.
So it really depends on your life situation, your scenarios, on what's really happening within your world. Do you need to have a job in college? Many students do.
Absolutely. Good advice. The other thing is, when you are in school, when you are in high school, if you are a senior, junior, senior in high school, get it into your head right now. Study, study, study. Get a scholarship. I have some students that are going to college this fall on a full scholarship. It's not easy to get them, but you apply, you work hard, and then you hopefully get them. I have a young man, and a friend of mine who now has become a friend of mine, but a former student, started as a nursing assistant. And then I taught what we called an acute care nursing assistant course that I wrote. And students then went from nursing home to hospital nursing. He did that with me. That's how I actually got to know him better. And then he went on to be an LPN. Then he went on to be an RN. Then he went on to get his master's in nursing. And I just ran into him lately. And he is about ready to become a physician's assistant. He started as a nursing assistant. And along the way, as he increased his interest and dedication, his mind changed. And when it changed, he had other avenues. So you can do any of those things, but you know, right now I think it's important as well that when you start thinking about what you want to do, that you focus on what you're currently doing as well, making, you know, the best decisions, working the hardest that you can in high school.
Yeah, and I hope that kind of covers, you know, we only have about 20 minutes left, so I want to be sure that we cover a different range of questions and topics all within kind of nursing and healthcare. So
Sure.
I hope that answers all the questions that I'm seeing here in the chat for students that are asking about, you know, if they should be a nurse right away, if they should continue and go through either a residency program or become an NP. It really just depends on your scenario. Let's see here. I got another question. A student's interested in becoming a nurse anesthetist or something within that area. Do you have any advice or info that may be pertinent to that sort of a career path?
Sure. I have a couple of friends that went into that area. They were LPNs first. This gentleman was an LPN first and then decided that he wanted to get his degree. And he went ahead and did that and then became a nurse anesthetist. Now, I will say this, if you want a lot of patient contact, this is not the career for you. By that, I mean, yes, you have your patients. You get to see them prior to surgery. You would probably visit them the night before surgery. And then you would, in the morning of surgery or whenever, would visit with them again and then literally help them drift off to sleep so they can have their surgery. There's not a lot of contact with a patient. After surgery, you can go up into the room, or if they're in ICU or CCU, cardiac care, and you can visit them, etc., make sure they're doing all right, but that's about it. So it's a long road. It's a very, it's not an easy road. There's a lot of chemistry involved, a lot of physics involved, because you're dealing with, think about it, you're dealing with these potentially deadly gases that you're giving to your patient. And so there's a lot involved in that. The money, the financial part of it, yes, great. And you're needed in very many areas of small town, big town. So it's a good career, but it requires a special person who does not really need to have a lot of contact with their patients. Does that make sense?
Yeah, I think that sounds really good. Let's see here. I got another question about communication skills, and I can kind of give a more broad answer after this as well. If you don't have really good communication skills within the medical field, would it be difficult and would it be a good fit, or how would I build on those communication skills?
You know, that's a really interesting assessment that you have of yourself. And I admire you for that. Number one, if you feel you got lousy communication skills, there are so many things, classes that you can take to help you get better at speaking, at talking. Do you have to have perfect English? Well, grammar, let's put it that way. Well, you know, no, I don't have perfect grammar. I say yeah, different things like that. It's gotten me through for many, many years, but I think that that's not poor communication skills. You feel that you aren't able to have a conversation with someone else, and that's lacking in your life. You can take courses, you can take communication classes that will help you develop that ability to speak to someone else. When you get more confidence, you will increase your ability to communicate. Should you not come into healthcare because you can't communicate beautifully, eloquently? No, if this is your heart's desire, then you will do what you need to become a better communicator. It's as simple as that. Now, If you just are not really sure that you not only don't, you feel like you aren't a great communicator or communicate well, but you want to have something to do with healthcare, you know what? There's a lot of things you can do. You can go into medical records, for instance, which is another whole pathway. And what do you do in medical records? You look at medical records. You make sure they're okay. You're with a computer. You're with charts. Do you have patient contact? Nope. You probably will have your coworkers. That's different. So, you know, you could definitely do that. You could go into phlebotomy, drawing blood. Do you have patient contact? Yes. How much do you communicate to someone when you're drawing their blood? Hi, I'm Pat Reinhardt. I'm going to draw your blood today. How are you? Good. Okay, here we go. Great. Thanks. Make sure you keep the pressure on for a while. Take care. You should hear from your doctor in a few days or a week or next day, whatever the case might be. So there are other ways in which you can be in healthcare. But again, I urge you, if you are this good at who you are, self-assessing, take classes to help you be a better communicator. Because we need people like you who can self-assess like that.
Yeah, definitely. And I think that self-assessment piece is really important to students as you continue to grow throughout your entire life too. So don't think that just because you're graduating high school that you have all the skills and those are the same level of skills that you're going to have your entire life throughout your entire career.
Oh, absolutely.
Maybe you know that you're not good at communicating. Many times in college, especially through your general education, you're going to have to at least take one public speaking course.
Yes.
So, you know, even if you're uncomfortable speaking to groups of people, you know, work a little bit in your uncomfortable zone so that you can start to work on some of those weaknesses too, no matter what they are, and start to realize some of those.
Absolutely.
The other piece that I'll talk on too, just with communication, and I see this a lot with my work because similar to Pat, I do a lot of research on what jobs are out there, what they're asking for skills, even down to some of the interview questions that you're going to see. And I'll tell you, almost more than not, within the top 3 skills that almost every job needs, especially within healthcare, but even a more broad spectrum outside of healthcare too, communication is one of those top 3 things that they ask for. Now, like Pat said, that doesn't mean you need to have perfect English. That doesn't mean that you can't know a second language or that you're not bilingual or anything like that. But I guess my point is just really think on some of those things that you would need within these careers. And if you know that that's one of your weaknesses, don't be afraid to work on that because that may become a strength 2, 3, 5 years down the road. And it may be your favorite thing that you're doing within a job and not just communication based, but some other skill possibly too. So, yeah, keep that.
And that's, you know, we connect that way. We connect to people through communicating. Duh. I mean, really? So, I mean, it's even more important that you fine tune your communication skills with someone who is at one of the worst lows in their lives, you know? So you got to be able to get in there. But I will say this, when I was the director of nursing and I hired nurses and nursing assistants as well, one of the things that I always could tell quickly, and I think this happens when you come into healthcare. You are able to assess people quite readily and actually quite well. And one of the things that I always felt was important is I would rather hire somebody with a great sense of compassion than fine-tune skills, because I can always take someone who may be lacking a tad in a skill here and there, and I need to fine-tune that a little bit. I can do that. But it's very difficult to get somebody who has no sense of compassion to become a compassionate caregiver. It isn't easy because you can't really teach compassion. You can show it, you can display it to others, and you can talk about what it involves, but that's something that you cultivate within who you are. And if you don't have that compassion, then it's pretty hard to come into healthcare. It's really difficult to come into healthcare. Any other questions? No, I'm sorry, go ahead.
Nope, that's okay. We got 2 more questions here, and maybe if we have one more question, it looks like we have about 8 or 9 minutes left here.
All right.
And both of these are pretty similar. So Megan and Tegan, I'm going to kind of combine these two here. They're asking about the difference between 2-year and 4-year duties and pay, and what's the difference between that education as well? What's the difference between an associate's and a bachelor's?
Oh, sure. Not a problem. Good. Well, an associate degree is that 2-year program. That's when you go to school. Associate degree in nursing. That's when you go to school for 2 years. And in that 2-year time, you have your prerequisites first. So you would take anatomy, et cetera, all those prereqs that you need for healthcare, for nursing. Then after that, you get specific. And you get areas, you go into areas of obstetrics, surgical, patient, psych, but those experiences are short. So I can give you a quick example. My obstetric training when I was in nursing school was 3 months. That was in the labor and delivery. That's a long time. Now it might be 2 weeks, or it might be maximum 6 weeks, 4 weeks. So it's much quicker. As far as responsibilities, what do you do as a 2-year RN? You still will be able to be a charge nurse, but the likelihood is that a lot of hospitals will prefer a 4-year RN, but that doesn't mean you can't be a supervisor as a 2-year RN. I always feel like if you really, well, again, it's really up to someone's individual choice. There's absolutely nothing wrong with being an associate nurse. Nothing. You have pathways open to you. But if you really think you want to do this, and continue, maybe nurse practitioner someday, like we said, and get that 4-year degree. As far as finances, because the 4-year degree, let me go back to the 4-year, comparing it to the 2. 4-year degree, you have a lot more leadership. If you desire to have hands-on nursing, 4-year may not be the one for you. If you really want to get to the bedside of a patient, take care of them, whatever that means, then you might want to be a 2-year or an LPN, but you might want to be a 2-year RN. If you're going to be a 4-year RN, you're going to get administrative duties. And if that's okay with you, that doesn't mean you can't be a bedside nurse, but rarely do you see bedside nurses. Usually they're team leaders, they're charge nurses. It's not wasted education. If you like administrative sorts of things, this is for you. There's a difference in pay. Usually RNs starting pay is about $32 an hour. Again, this is in Minnesota, depending on where you go, depending on what hospital you're at. And it certainly is not $32 an hour for a 2-year RN. It's anywhere between about 25 up to 28, depending again where you go. I hate to give you these figures because as soon as I say that, you're going to go, yeah, but. And so it does depend on where you're working. Big city, hospital, small city, hospital. So 2-year versus 4-year, it really is leadership for 4-year focused. A lot more assessments as to why people are the way they are, why diseases happen, a lot more of that kind of thing. Whereas the 2-year RN is a little bit more focused on the patient. Again, these are general terms or general statements that I'm making.
Yeah, and I think it's really good for everybody to just think on your own individual situations too. And I know that I've talked on this not only today but before too. But don't just go to college or a school or go into a program because that's what your friends in high school are doing or that's what somebody else told you to do. Really think on what you want to do and chase after that too. And I hope one of the biggest takeaways that you all have from this conversation today too is that you don't need to have the same career throughout your entire life. You can have different steps throughout that career. You know, somebody like myself in my situation, you know, I was a first generation student going into college. It probably would have made more sense because I didn't have the money to pay for college right away. I had student loans and I'm paying those back now. But, you know, it's always a good thing to think about going to a 2-year institution, possibly doing part-time with a job, get your generals done, or maybe you go and get your ADN, become an LPN, and then maybe 2-3 years down the road, you could think, you know, I really want that next step in that leadership position. And you can move into going through your RN.
Sure, sure.
One thing too that I know we have about a couple minutes left, and I don't think any students really asked this question, but I think it's important to talk about, especially within registered nursing. But you could go through and get your 4-year BSN, and Pat, that doesn't mean you're a registered nurse, right? Because you need to take what tests to become a registered nurse.
Right, right. You do need to take your tests, your Board of Nursing. It's changed. Now it's computerized testing. Once you take that test and you pass it, then you get your nursing license. And then as a nurse, like I need to do every 2 years, I have to still at this point in my life get renewal units. And in fact, I'm doing that right now, and I decided I was going to take a course on the essential needs or the needs of humor in healthcare. And I thought, maybe that sounds interesting. And so we'll see how that all goes. I'm going to start that here shortly. So your education never ends. Well, it shouldn't. I mean, it shouldn't for any of us, no matter whether we're coming to healthcare or, you know, whatever you choose to do in your life. You want to keep lifelong learning as your partner, because it makes life so much better, so much more interesting. Take it from me, I know. You know, I have been around the block a few times, and I still am learning. I learned how to do Zoom and set up Zoom this summer and teach on it. Do you think I knew anything about it? Nada. Zippo, nada. And yet, you know what? I learned how to do it, and it was exciting and fun, and I think I'll do it again. I worked on videos with Health Force Minnesota. If you watch the nursing videos, a friend of mine, and we did it, and with Sue Fields, and you know, something I'd never done before. It's pretty easy just to sit in the old rocking chair and say, okay, that's it. You want to keep doing this. You want to keep looking forward. It is exciting. Healthcare is ever changing. It's exciting. You got to be on top of the game. You have to be dedicated. There's no halfway. You don't have to go to school full time. You can still have a life. But you do need to remain focused on your dreams. And I encourage you, in this last NA class I taught, nursing assistant, I had 3 students that were going to be PAs, 3 that were coming into pre-med. The rest were either RN students, going to be RN students, and I think I had 1, maybe 2, that wanted to be a nursing assistant for the rest of their life. Hallelujah, that's great. But I would say that stay focused. Know that you can do it, but let it be your decision to come into healthcare. Your heart has to tell you what to do. No one else can do that for you. They can guide you, they can give you tips, but if it's not in your heart, don't waste your time, because your patients will feel why you're there next to them. Not because of a sense of love and compassion for your career, but because it's a job. And that's not what this is all about. I would encourage you, if you have questions, you can, see if you want to contact me. I can certainly help you with some, questions that you might have yet. I'm with Health Force Minnesota. I'm with Hennepin Technical College, and I'm more than happy to help you. And I do wish you well. I'm so excited for you. You have so many good days ahead of you. It's not an easy pathway. It doesn't have to be easy. It just needs to be your chosen pathway.
Yeah, thank you, Pat. I appreciate all those thoughts and words. And I know today we talked a little bit on nursing careers, and we covered just some other general career and life advice, which I think is always great and always well needed for everybody. If you do have any questions, students, please feel free to either message me on Schoology or send me an email, and I'd be happy to forward those to Pat. And if she has the time in her such a busy life that she has going on, I'm hoping she can answer those for you. But if not, we'll get those answers and get that figured and sorted out for you too.
That's
But
right.
really take some of this advice that we had brought today and really listen to some of Pat's words too on just the career field within nursing, because it's so expansive. It's not just working the bedside. It's not,
That's right.
you know, like Pat opened up and it said right away, and I've heard this from many nurses, it's not like what you see on TV by any means. So if you're going off of Grey's Anatomy and that's why you want to be a nurse, maybe shadow somebody or ask some questions for people working in the field, because it can be very different whether it's a small hospital, a big hospital, a geriatric facility, long-term care facility. It is so different, and the duties are just so broad across the field. So
Absolutely. And this is an open field for anyone. So I wish you well. I'm excited for you. You have a great life ahead of you in healthcare. And as was stated, if you have questions, they will be directed to me, and I am happy to help you. I do have time to answer your emails. So don't hesitate.
yeah, thank you, Pat. Everybody have a good rest of your day and have a good weekend, and we will get back to it on Monday.
Wow. Take care. Bye. Thank you.